So every second week, we share with you data that describes our progress against the pandemic. We present models that try to anticipate the likely course of the pandemic, and we try to paint a more complete picture of the pandemic's impact. Its destructive impact on our health system, the threat it presents to mental health, and the importance of schooling, even during the pandemic, for children and families. This week, we will focus solely on our progress against the pandemic, and our progress is both frustrating and frightening. I believe we are all feeling something similar right now. Whether we're working in a hospital, a warehouse, or a restaurant, whether we're a student or a retiree, everywhere, from my hometown of London up to Ottawa, from Windsor through to Kenora, I know some of us are frustrated, some of us are frightened, and some of us are just fatigued, and many I know are all three. After more than a year of fighting this together, we are now entering the hardest stage. Cases have risen, hospitals have filled up, and across Ontario, it is very clear we are very much in the third wave of COVID-19. And the numbers are still rising. But the biggest problem we now face may be that we're just too tired to notice. So I'm begging you as part of the team to notice. Notice that our hospitals can no longer function normally. They are bursting at their seams, we're setting up field hospitals, and we're separating critically ill patients from their families by helicoptering them across the province for care. Our children's hospitals are now admitting adults as patients, and this has never happened in Ontario before. It's never happened in Canada before. Notice, please, what is happening with vaccination. More people are getting vaccinated. We're about a quarter of the way through now the province's strategy. We're now focusing more on the people who need the vaccine the most, but the disparities are still there. The communities who need the vaccine the least are still getting more of it than the communities that need it the most. Our public health units are trying to prioritize communities to control the spread of the disease. This may be different in each public health unit, but please notice when it's your turn, and please get vaccinated. The vaccine protects you, and it protects the people around you. And the faster we get the third wave tamped down, the faster we open up. Notice when your friends, your neighbors, your children, or even your parents meet each other without masks. Notice if your workplace is open, but it shouldn't be. Notice if your workplace isn't safe. Notice the behaviors that we all know will put people in hospitals. In the same hospitals where we don't have enough nurses, respiratory therapists, or doctors to treat the patients. Notice that stuff and say something. It's uncomfortable, but it will save lives. Notice the places that have turned this around. One of them is right here in Ontario, Thunder Bay. Thunder Bay was the center of a huge outbreak only 2 months ago, but it's flattened its curve in an impressive way. The whole city came together, shut itself down, focused on the fight, and got it done. We all have to be like Thunder Bay, and we all have to do what we can do to reduce our contacts and reduce the spread of the disease. Notice California, which only a few months ago was suffering crises like the one we're starting to experience here, and which is turning it around. Not just because they have vaccines, because people went out of their way to get the vaccine. We have to get vaccines into each other's arms. There's no point in looking backwards right now. Notice that when you want to do that, and please look forward, because the going forward playbook is very simple. Here's our collective playbook. We need to keep the vaccine rollout laser focused on those Ontarians who need it most. We know who is vulnerable to COVID-19. They need the vaccine first. We need to keep workplaces safe. If we want to break the spread of COVID-19, only essential workplaces should be open right now. We need to stop infection coming into our essential workplaces to keep them open. This means people should not have to choose between keeping food on the table and keeping others safe by staying home. We need to support people so that they don't have to make that choice, and many people may need extra and easy-to-access support to stay at home when they're sick or they've been exposed to someone who is. This is true for cases and for close contacts. And we need to make sure that workplaces stay safe with enforcement. We need to limit, as much as possible, the entry of cases of the variants of concern. B.1.1.7 is now the overwhelming cause of COVID-19 in Ontario, but it responds to vaccines. There are more concerning variants around the globe and within Canada. We need to limit the spread of these even more concerning variants across our communities. This means limits on borders and on movement. Our playbook as individuals is just as simple. I know we're tired. I know we're demoralized, and I know some of us are heartbroken. And I know that all of us want to take a break. But hang in there, please, with these three things. Just these three things, because these three things will help stop the pandemic. Don't spend time with people indoors. When you do need to be inside to shop, to take transit, or perform other essential tasks, please wear a mask. When you meet people outside of your household, meet them outside. And again, if you can't stay 6 feet away, always wear a mask. Get a vaccine when it's your turn. Help others get a vaccine when it's their turn. And wait for the vaccine when it's not your turn. That's it. Compared to the fatigue, the frustration, and the fear we feel, these three things are well worth it. They will help break the spread of COVID-19 until we can vaccinate enough people. The disease is complicated, but our playbook is simple. That is what the evidence tells us. It also tells us that the longer that we let this drag on, the worse it will be. And with that, let's get into the numbers. As we start to do the presentation, I'm sorry the sign language translation will disappear, but it will come back immediately following the slides. If we could put up the slides, please. Thank you. Let me start, as we usually do, with the key findings. So COVID-19 cases, hospitalization, and ICU occupancy are at their highest levels since March 2020, and variant cases continue to rise sharply. And when we talk about high levels of ICU occupancy, we're almost 700 today, and over 70 admissions yesterday. This level of ICU occupancy is compromising care for all patients, for all Ontarians who may need it. Ontarians can help themselves and others by limiting mobility to truly necessary trips and always wearing a mask and keeping 6 feet distance when in contact with anyone outside of their household. Although it's improving, vaccination is not reaching people at high risk fast enough to overcome the level of serious illness in our communities and our hospitals. And without stronger system-level measures and immediate support for essential workers and high-risk communities, high case rates will persist into the summer and perhaps through it. Let's turn to the first chart, which shows the rate of growth of cases across public health units in Ontario. You can see in virtually all of our public health units now, there has been substantial growth in the number of cases over the last 2 weeks. You can see that it has come down in a small number of public health units. This is largely due to strong public health measures being in place. And you can see as well here, I hope, that many of these increases over just 2 weeks are doubling of case rates. Test positivity rates are also increasing across Ontario. You can see here that the test positivity rate when we calculated it earlier this week was 8% for the entire province. Both the case rate and the test positivity rate are above the level that we used to call red or control, which gives us a sense of where we are as a province, that most of our communities are now in that level that we would be instituting very significant restrictions. And continuing, Ontario testing rates are flat. The increases in cases is because there are more cases, not more tests being done. When we see a stable level of testing, an increase in cases, and an increase in positivity, this tells us that this is a real increase in cases, and in this case, a substantial and sharp, essentially exponential growth in cases that we see in the province. Now, throughout the pandemic, we've talked a lot about the reproduction number. This is really a reflection of how many people are infected by every person who has a case. The higher the reproduction number, the more people who are infected. We've talked about the greater transmissibility of the new variants of concern, the variants that were originally discovered in the United Kingdom, in Brazil, or in South Africa, and we've known that these were more transmissible. As you can see here, the reproduction rate for the variants of concern, which is in the left-hand panel in the orange chart, is well above 1. That's a sign of exponential growth. That means that cases are going to continue to grow substantially and rapidly for a while. But what's important is to note the right-hand side as well. The right-hand side in blue is the reproduction number for the earlier strains, for the wild-type variants, for the ones that were first identified in Wuhan in China. And you can see here that this reproduction number is also now over 1. So we're seeing a growth in the variants of concern that is dramatic and sharp. We're also now seeing growth in the earlier variants, which means that we are not really at the point yet of controlling the disease through the public health measures. Continuing on, this chart shows you the growth in hospitalization since the beginning of September last year and the growth in ICU occupancy. If you look over at the far left-hand side of the chart, you'll see that hospitalizations and ICU occupancy were very low in that lull period during the summer. This is a function of people completing their care, of people dying, of a variety of issues, but really we're able to empty out our intensive care units after the first wave. You can see in the second wave, the wave that really builds throughout November and December of last year and into the big bit of January, you can see that dramatic growth in hospitalizations that is accompanied a little bit later by a growth in ICU occupancy. But what's different now about the second wave, or what's different now about the third wave compared to the second wave, is that our ICUs, our intensive care units, never had the chance to empty out again. And so as we hit this third wave, as ICU occupancy rises, and remember the new variants of concern are not only more transmissible, they're also more dangerous. They are more likely to result in hospitalization. They are more likely to result in intensive care unit admission, and they are more likely to result in death. We're now filling up our intensive care units on top of what was still there following the second wave. And this is one of the reasons that we are in such jeopardy with our intensive care units. Let me turn now to the modeling, the projections of where we're going to be in the next little while with the pandemic. Once again, this is not one model that we're running here. This is 4 groups of scientists running different models with many, many scenarios. What we've tried to do here is consider what our likely trajectory would have been about 2 or 3 weeks ago, before the start of the public health measures. That's the red line. The yellow line here gives us a sense of where we would be with our current, or the ones that were announced most recently in terms of public health measures. That's kind of the moderate or the midline case. And then also what we would look like with stronger public health measures, perhaps more similar to the level of reduction in mobility that we saw at the beginning of the pandemic in April last year. And that's the green line. And you can see here as well a couple of other assumptions and variables that we tried to deal with. First, we're assuming here on all of these models 100,000 doses of vaccine a day. That's roughly where we are right now. We're also assuming about a 60% effectiveness in terms of stopping transmission, not in terms of reduction of mortality, not in terms of reduction of hospitalization. Those are higher percentages that we use in the models, but here, percent effective in reducing infection. And we're assuming it's a relatively random administration of the vaccine. The other thing that we consider in all these is how long the public health measures last. The solid lines are for 4 weeks, and the dotted lines are for 6 weeks. As you can see here, had we not instituted the public health measures, the models are suggesting that we would have had a much, much higher rate of case growth, to an almost unbelievable level of perhaps 30,000 before it would peak and come down. What the models are suggesting now, looking at where we are more likely, which is the yellow line, is that the case growth is going to be much less substantial. And if public health measures extend for 6 weeks instead of 4 weeks, we really blunt the second round of growth as part of this wave. You can also see with stronger public health measures and a longer, that dotted green line, a longer period for them, for 6 weeks, we actually would get down to a much, much, much lower level of cases, much similar to what we would have seen during lulls between the waves, rather than what we're seeing now. I also want to note here that we've been looking at the briefings from previous weeks. The red box here indicates the range that we anticipated in the last briefing. And all of the models are in line with what we would have predicted in the last time. Before I move on to the next set of notes, I do want to note that the goal here is to flatten the curve as much as possible, to push that curve down. Every time we hit one of those milestones where we're starting to control growth, where we're starting to flatten the curve, that's a cause for celebration. That's an indication that we're getting closer to a more normal summer. It's a goal I think that everyone can kind of work towards, and we actually are able to see our progress almost on a daily basis of whether or not we are or not flattening this curve. If we go to the next scenario, I know that there's a lot of attention on vaccination. We took a moment to consider what it would look like if we had about 3 times as many vaccines being administered on a daily basis in the province that we have right now. So although we are not administering 300,000 vaccines a day right now, we did consider what would happen if we started administering 300,000 vaccines a day today, Friday. You can see, I think, a couple of interesting things here. Even under the weak scenario, that earlier scenario that we're no longer on that trajectory, that red scenario, it brings the peak down, it shifts the peak to slightly earlier, and it brings down overall the total number of cases. If you look then at that top yellow line, that top dotted yellow line, that's the moderate public health measures. That's where we think we're at right now in terms of the effectiveness of our current bundle of measures. That top line is a 6-week imposition of those measures. If we had 300,000 vaccines a day, starting today, you'd see that line drop further, and you'd see a lower peak and an earlier peak. And it keeps on coming down quite nicely. And if you look at green, which is the stronger set of public health measures, again, with the assumption that we did have 300,000 vaccines, which we don't have right now a day to administer, that peak is earlier, lower, and the whole curve gets lower. So public health measures make a significant difference and have already made a significant difference in what we would see in this pandemic. Longer public health measures help really tamp down that curve and make sure that we get the cases under control. And more vaccines, if possible, actually add significantly to both the help significantly with the duration of this wave and the overall trajectory in the long run. Let me talk about what these different models now go back. I think we've lost our slides. If we can, thank you. Let's go back now to the ICU projections. So here again, we're assuming 100,000 doses of vaccine a day. We're assuming that patients are following normal protocols and entering intensive care units when they need the care. We're at about 690 patients in ICUs today. We had about 74 admissions to ICU yesterday. You can see that we're really growing at a very steep pace right here, right now with our intensive care unit occupancy. And we're starting to get to that very sharp part of the curve where growth is significant. Under any of the scenarios, I want to point out right now, under any of the scenarios, growth keeps on for the next 2 weeks. Whatever we have right now in terms of cases is really baked in terms of what happens to our intensive care units over the next 2 weeks. But you can see, if you look at the insert, that stronger and longer public health measures do help push down the overall target that we could hit. But over the next 2 weeks, it's likely that we will exceed 800 patients in intensive care units. That is well above the old threshold that we discussed of about 300. We are on track over the next 2 or 3 weeks to actually hit almost 1,000 patients in intensive care units. And unless we're able to break that, we could actually see higher and higher levels. Now, it's not clear that all those patients would ever be able to enter an intensive care unit bed. Even with the heroic efforts going on across the province to increase capacity right now, there may just not be the ability to put them into these types of beds. And not only that, there may not be the ability to put other types of patients into beds who require intensive care. So we are right now at a very significant point of growth in intensive care unit occupancy. Let me talk now a little bit about what's driving this growth in intensive care unit occupancy, what's driving the growth in cases, what's driving the growth in hospitalizations. This slide describes mobility. We'll go through 2 slides on mobility. This is really based on publicly available cell phone data. We're able to understand when people are outside or a good distance away from their home. You can see here that following the public health measures around the winter holiday, you can see there's a substantial drop in mobility and it stays low for a while. This is really the result of first, people staying home around the holidays, but as importantly, the public health measures, and although they persisted for a while and were frustrating and challenging, you can see that they helped tamp down the level of mobility substantially and really brought it below a mobility threshold, that dotted line there, which is necessary to prevent spread of the pandemic. You can see, though, as public health measures have relaxed, that mobility has increased again substantially. And anyone who is looking at one of our major streets here in Toronto or commuting back and forth from work on one of our major highways is probably able to see that increase in mobility very easily. And although it is starting to come down now with the new public health measures, you can see that curve coming down on the far right-hand side. It's not down far enough to control the spread of the pandemic. On this next slide, you can see we've decomposed some of this change in mobility to look at places where people are often indoors, workplaces, retail and recreation, and transit. And you can see basically the same pattern again repeated. A drop around the holidays, followed by an increase, and then eventually an increase above a level that's really necessary to sustain control of the pandemic. And then just the start now as well of it coming back down, which hopefully indicates that the public health measures are starting to work. But we're not yet at that level of mobility at this point in time that would allow us to really control spread. There is other mobility data, but we're focusing on indoors here because that is where the majority of spread happens, is indoors. Continuing on, you can see the impact on the health system continues. We're now at a backlog of surgical cases of almost 250,000 since the start of the pandemic last March. That is a huge volume of care that is delayed or postponed. With the slowdown in care that you're seeing now at hospitals across the province, this is going to increase, and we expect that rate of increase will actually be faster and more dramatic despite efforts to try to maintain access to care. Looking here now, we can turn to vaccine progress, and this is where we have some good news in what's going on. The strategy is about a quarter of the way through. In fact, it's more than the 24% through that we're presenting here. This was calculated a few days ago, and it's actually increasing now over time. If you look at the far left-hand side of the panel, that's the bar or the part of the bar chart for older people. This is over 80, and you can see that it's almost blue, which is people who've either had a first dose or made an appointment for their first dose. And there's only a small bit of yellow left, which is people who've not received their first dose. Moving to 70 to 79, you can see again it's a substantial number. The vast majority of people have received a first dose or are booked now for their first dose. But when we get to 60 to 69, you can see that actually it's only about half have either received their first dose or been booked for it. And then looking over at the right-hand side, you can see under 60, younger people in the province, this is a substantially lower amount of vaccine that's been provided and taken. Moving on, you can see here the same chart as we presented last week. In this chart, it's worth just taking a second to kind of work through it. We're comparing neighborhoods by how high the rate of COVID-19 is. So one, that far left-hand side column, one is the highest risk neighborhoods. 10, the far right-hand side of the column, is the lowest risk neighborhoods. The first row is the oldest group of Ontarians we're looking at here, which is over 80 years of age. The bottom row is 16 to 39 years of age. You can see that we actually had a very large discrepancy between the lowest risk neighborhoods and the highest risk neighborhoods when we presented last time. This has started to narrow. However, it's important to note that still it is 82% of people in the lowest risk neighborhoods who've received a vaccine. It's only 65% of people in the highest risk neighborhoods who've received a vaccine. And so that is a difference that needs to be closed, and actually we would hope to see more people in the highest risk neighborhoods having received a vaccine. The picture actually is improving, though. That's a smaller disparity than in the past. And as we start to move down into younger age groups, you start to see the type of difference that we'd like to see. Say, for instance, in the age group of 70 to 74 years of age, 57% of people in the highest risk neighborhoods have received the vaccine. 39% of people in the lowest risk neighborhood have started to have received the vaccine. And so that's the sort of difference that we want that will really help control the spread of the virus in the highest risk neighborhoods. That picture continues on for a while through some of the middle age groups, but you can see as we get into younger age groups again, that disparity emerges again. For instance, in age 16 to 39 years, 5% of people in the highest risk neighborhoods have received a vaccine, whereas 10% of people in the lowest risk neighborhoods have received a vaccine. And so it's important to keep on correcting that level of disparity. Now, moving on to our last slide of results. If we took about half of our vaccine and we focused it into these highest risk neighborhoods, it pays a substantial dividend in terms of control over the pandemic. And so we're considering here a vaccination strategy that is at about our current level, at about 100,000 vaccinations a day. We're thinking about putting about 50% of vaccines into the 20% highest risk neighborhoods. And you can see that it actually provides a substantial improvement in control over cases compared to allocation of vaccines based on age and population size alone. And if you'd like to think about the number of vaccines you need to give to stop or avert a case of COVID-19, if we just do an age-based allocation across the province, it takes about 60 vaccines to avert a case. And instead, if you really focus it in with about half those vaccines in the highest risk communities, it takes about 30 to 35 vaccines to avoid a case. And so a very, very big return if we're able to continue on with this focus of vaccines, as is indicated in the phase 2 of the strategy, focus in on high-risk communities as much as we can. I'll finish here with our key findings, as we always do. If maybe we could return to the slides. Thank you. COVID-19 cases, hospitalizations, and ICU occupancy are higher than they've ever been before. ICU occupancy is compromising care for all patients. Ontarians can help themselves and others by limiting mobility to truly necessary trips, always wearing a mask, always staying 6 feet distant from anyone who's outside their household. Vaccination is improving, both in its rate, or its volume, and in terms of its focus on the areas where it'll do the greatest good. But we're not moving fast enough yet to overcome the level of serious illness in those communities, and that is in our hospitals now. And without stronger system-level measures and immediate support for essential workers in high-risk communities, these case rates will persist. I'm moving on here to the contributors. These are the scientists and experts from across the province who've contributed to the material in this briefing. And I could spend a lot of time just calling out their volunteer work here. I'll also note that there's about 120 scientists who serve on the various tables right now providing advice, and I'm really grateful for what they provide every week.